third doses. There are other countries, especially the United States, actually going to be offering third doses to everybody. I know we're not there in Canada, but could you foresee seniors in long-term care perhaps being next in line for a third dose, or say anyone in our community over the age of 75? Because it seems like vaccinated people who end up in hospital with serious cases tend to be older.
That's absolutely right. It is, if you get breakthrough, and the small percentage that do in older people, yes, they're more likely to have more severe illness and end up in hospital, as we know. So there's a couple of things we're looking at. So this is the third dose as part of the primary series for people who just don't respond as well to vaccines. And we know that the studies show that people who don't have, with severe immune compromising conditions, the ones we're talking about right now, as many as 40% to 50% don't have any response, don't mount any detectable antibodies after 2 doses. And about half of them, as many as 55% of those people who didn't respond after 2 doses, will have a response after 3 doses. So that's good, but it still means there's a proportion of severely immune compromised people who don't get protection from the vaccine. So this is a completion of the series for those very high-risk people. For most of us who do mount a good immune response, we tend to see that fading over time. And so one of the things that we're doing to monitor that is what we call vaccine effectiveness studies. And the BC CDC, under the leadership of Dr. Skowronski, has been ongoing measuring the vaccine effectiveness. And we just had an update this morning, and those data will be coming publicly very soon. But it looks like we're still maintaining a very strong response. One of the things that is different here in Canada than in the United States, in Israel, is that we very early on extended the interval between dose 1 and dose 2. So there's a couple of reasons, as you well know, that we did that. One was getting that higher level of protection in more people more quickly. But the other one is because we suspected and knew from basic immunology and other vaccine programs that it was likely to give a stronger and longer lasting response. And we're starting to see the evidence of that. So right now, we're not seeing the need for a booster dose for most people, even seniors, community dwelling seniors. Where, as you mentioned, the area that we are paying close attention to is seniors in long-term care, because of the risk of those settings where so many vulnerable people are together, and what we're seeing when vaccine gets in, even in people who have 2 doses of vaccine, it can still spread. So that is the next group of people that we're looking at the data, and we'll have more to say about that. The National Advisory Committee met last week and is meeting again this week to look at data around particularly seniors and residents of long-term care. So I suspect that that will be the next group that we'll be looking at. And as I mentioned, what I'm hopeful, given the intervals that we've used here in BC, that it will hopefully align with our immunization program for influenza, and we can protect our seniors and elder in care from both COVID and influenza sometime in October. But that's my speculation at the moment. We'll see what the data comes out with in the next couple of weeks.